This is a good and wonderful day. I'm going to ask Dr. Mark Morse. He is on our health and wellness team. He is going to come up and give you some insight into why we are doing what we're doing. So Mark, if you'll come up, please.
Well, first of all, let me introduce myself for those of you who don't know me. I'm Mark Morse. I'm a family practice physician. I practice here in Dahlonega with the Northeast Georgia Health System. And I'm here today as a representative of the healthcare committee that we have here at the church, and just wanted to explain to you guys why we came to the recommendation to start going back to some of these restrictions again. Because I know it's frustrating for not only me, but for a lot of you guys too. Things were almost starting to look like they were getting back to normal again. You know, singing in the choir, practice, no masks, and it's frustrating. And it was not an easy decision, but I just want to explain, just so you can understand why we made the recommendations we did to the staff. And I'll try not to be, public speaking's not my favorite thing, and it's not my best thing, but I'll try to be as succinct and clear as I can about everything. The reason is, right now, you know, in January when things were at its worst with the, I'll call it the Delta or the Alpha variant of COVID, that was the first, variant of COVID that we had to deal with. January was probably the worst month we had here nationally and here in Lumpkin County. If you can remember, that was when things were really bad. Hospitals were full, ICUs were full, everything was kind of in lockdown. Right now in this area here in North Georgia and Lumpkin County is as bad, if not worse, in regards to the number of positive cases, in regards to the number of people in the hospital and going into the hospital and continuing to go up and up. ICU, and now we're starting to see the spike in deaths again. But it's different. This Delta variant is different. We're learning more and more about it, but you're going to start hearing things, and I want to be able to try to at least clear some misconceptions up, because I think one of the most frustrating things for me in dealing with my patients is that I don't think things have been explained to them as well as they should. It takes some time, and most of the time as physicians we're in a hurry, we just don't have time to talk about it. But the first thing is, when it comes to masks, and without making any political statements, and those who know me, I know I'm about as conservative as they come, but the masks have always been not to protect you. It's not like a helmet or a seatbelt. It's not something we say, well, if I don't wear a mask, it's my choice, I'll get sick. The mask does not protect you very well from getting the virus. It does have some protective effects, but the mask has always been to help people who have the virus not to easily give it to other folks. Now, the virus itself is a tiny, tiny, tiny particle. It's tiny. It goes through, where'd I put my mask? It goes through that mask very easily. This is not a mask that's going to trap tiny little viral particles. And viral particles can get in around the sides. What this mask does do is it traps tiny little water droplets, tiny little secretions in our mouth and our nose. If you've ever seen somebody talk and the light's behind them and you hear them go you see little tiny water droplets coming out. Those contain millions of copies of the virus. Those droplets hit the nose, the eyes, the mouth, the mucous membranes, and within a few days can cause an infection. Those who get it don't know they have it for a few days until they develop symptoms, but while they're walking around for the 2 days after they came into contact with that individual, they're spreading it. This Delta variant is 4 times as contagious as the Alpha variant. I'm seeing in my practice, I'm telling you, this is the worst I've ever seen since I've been a doctor. It's the worst my colleagues have ever seen. Age shouldn't make a difference. When people are sick and they die, it's a terrible thing. But you always hear with this Alpha variant that, well, it was the elderly folks, and it was the folks that were really sick and had a lot of complications. We're not seeing that as much with this Delta variant. I even looked this morning, when you look at Northeast Georgia, and you look at the number of patients in the hospital that they're treating with for COVID right now, it's about 170. And about 20 that are just waiting on their results. They're probably positive. 79 individuals out of that 170 are 60 and below. That's their age. 35 are 50 to 60. So we're talking about the majority of patients are not 80 and above. In fact, there's only 25 patients in the hospital right now above the age of 80. All the rest are younger. I'm seeing 26-year-olds, 43-year-olds, 52-year-olds, mothers and sons and daughters. I'm seeing multi-generational families where the granddaughter, the daughter, the grandfather, and the great-grandfather all have it. And 2 are in the hospital and 2 are not doing great, but the youngest one's doing okay. It's rampant right now. We don't hear about it as much because in January this was a national problem where every state was going through this, and it was on CNN, on Fox. You couldn't turn on the news without hearing about it. Right now it's not on the national radar. This is a thing we're dealing with. Florida, Georgia, Tennessee, Texas. A lot of the other states don't have it up in the north and the northeast and out west, so you're not hearing much about it. So boots on the ground, it's bad. And because individuals can sit here today and not know they have it, but they can have this virus as they sing and they talk and they laugh and they sneeze, there's tiny little water droplets and respiratory secretions in the air that can travel to somebody that's close to you. Your mask that you're wearing will catch those, majority of those, and it'll keep those secretions from coming into contact with others, especially the unvaccinated folks. They're the ones that need the most protection. And them wearing a mask isn't going to protect them. It's other people wearing the masks that protects the unvaccinated folks from getting this. A lot of the unvaccinated folks are younger because they were always told, hey, this is a disease that gets the elderly and it gets the people with multiple medical conditions. And the Alpha variant was exactly that. The Delta variant's not. I mean, yes, it still does get the elderly and those with chronic conditions much more than other folks, but it's getting a lot of younger people. They're getting sicker quick and they're getting really sick with it. So we're expecting this to probably last, unfortunately, a few weeks, but not like before. I don't think this is going to be a long thing, but for right now, to protect, our congregation, I have no doubt that doing this it's going to save, I'll say, lives. Even if it's one, that's enough, but I'm sure that doing what we're doing right now is going to save lives. And that's worth it. So hang in there. I know it's frustrating, but that's why we made the recommendations. Don't give the staff a hard time because this was something that all of us who are in the healthcare condition, whether it was Mo, who's been flying patients back and forth in the helicopter, to the nurses and the doctors, we're seeing it. It's the worst I've ever seen. So be careful and wear your mask as much as you can. Wash your hands. Keep your social distancing. And hopefully within a few weeks, this surge is going to go down and burn out and we'll be okay again. But if you ever have any questions, you can always talk to me personally or call my office, and I'll be glad to explain things in more detail. But I appreciate you listening to me this morning. Thank you.